So I'm going to be talking about will ice decrease secondary complications in acute inflammation. So ice has long been part of our immediate response to injuries of many varieties, including sprains, strains, contusions, and fractures. For many of us, handing out ice bags after practice or games is part of our everyday routine. Athletes like ice for its pain relief, but they also have different expectations, such as reduction of inflammation or helping get their swelling to go down, and often expect ice to lead a quicker recovery. However, there is a shortage of evidence that is able to demonstrate conclusively the efficacy of ice application. There are no good clinical trials that have been performed on humans. Instead, we have several studies that were performed on rats. Immediately following the injury, there is an inflammatory response surrounding the injury. Ice is believed to lower the metabolic rate and therefore slow the initial inflammation, thereby reducing secondary complications. It's understood to accomplish this by vasoconstriction and lowering the temperature of the tissue. Purported secondary complications include damage to surrounding musculature, secondary cell hypoxia, and hemorrhage formation. However, the full extent to which secondary complications to inflammation exist and how cryotherapy is able to reduce them is an area which needs further research. One fairly recent study found that icing did not provide any significant difference in capillary density in the muscle, but that it delayed neutrophil and macrophage infiltration into the lesion site. According to a paper from 2004, ice application might be able to improve MSK recovery by limiting secondary cell death, but according to another paper, this is only effective if the ice is applied immediately after injury. In addition, inflammation creates swelling, which can decrease range of motion and cause atrophy, leading to a host of other issues. For many years, including older approaches such as Peer, Rice, and Price, and up to and including the more updated protocols like Police, we have given ice to athletes after an acute injury. Current best practice for managing acute inflammation are approaches such as Police, which take advantage of several different management techniques. In addition, ice is often applied when the athlete is feeling sore or bruised or has worked particularly hard during a game. The studies which suggest applying ice in an attempt to slow the inflammatory process are based on animal trials, specifically rats. The musculoskeletal system of a rat has different metabolic properties and will therefore respond differently to cryotherapy than the human body. Of course, a rat also has much less tissue to penetrate, so it is easier to decrease the tissue temperature. This makes it difficult to directly translate results. There is an increasing trend in literature which is moving away from the application of ice at all. The argument is that ice is meant to suppress the inflammatory response. But the inflammatory process is the natural response of the body to injury and is the necessary first step of recovery. Why would we want to slow that? We want to enhance healing. In fact, Merkin, the man who first published about rice in 1978, rescinded his stance in 2014, saying that instead of promoting healing, rice could actually hinder it. More recently, in the past 2 years, a man named Dubois published a paper where he introduces us to two new acronyms, peace and love, where peace is to be implemented immediately after injury and stands for protection, elevation, avoid anti-inflammatories, which includes ice, compression, and education, and where love is to be implemented after the first few days have passed and stands for load, optimism, vascularization, and exercise. Obviously, that is a whole topic in and of itself, but the thing to note here is that Dubois does not believe there to be any place for ice due to the lack of high-quality evidence and the fact that it has the potential to disrupt the natural inflammatory process. Understanding how ice application affects secondary complications is very practical information for us as future athletic therapists. As I mentioned earlier, we have almost a culture of handing out ice to our athletes for any ache or pain. We give ice bags on the daily. Our athletes often have wrong ideas about the effects of ice application. A better understanding of what ice does and does not do, of what it is proficient at and what it isn't, is helpful for us as we go forward to know when it is applicable to ice and when it is not. In conclusion, there is unfortunately a bit of a lack of research showing the true effect of ice application on secondary complications, so it's difficult to say with certainty whether ice will decrease secondary complications or not. Another area that needs more research is understanding the best parameters and application guidelines for ice application. However, ice is useful for, at the very least, numbing the pain by inhibiting nerve conduction velocity immediately following injury. It also appears to disrupt inflammation to some extent by way of lowering the tissue temperature and decreasing blood flow to slow the metabolic reaction. My recommendation would be to continue to use methods such as police to manage acute inflammation, as that combination of several interventions has been shown to be most effective, at least until more research comes out that could guide us to move on away from ice. Although the research has not shown conclusively that ice is the best way to manage acute inflammation, there is only a very, very small chance of further injury or damage or neuropathy. So, based off the principle of do no harm, there is no explicit reason that icing is a bad idea, because there's also not clear evidence that it is harmful to let the swelling go at the beginning. Make sure you keep in mind why you are icing and what goals you are hoping to achieve. Due to the lack of quality evidence, I recommend hesitating to recommend only ice to your athletes. Be sure to include other education tips.